today's media availability on the novel coronavirus COVID-19. Merci de vous joindre à nous pour cette disponibilité média au sujet du nouveau coronavirus COVID-19. Before we begin, I'd like to go over a few items. A reminder to please place your microphone on mute until I invite you to speak or to ask your question. To view who is speaking on Zoom, please put your view on speaker view instead of gallery view. The button for this is located in the top right corner of the Zoom video screen. Veuillez changer votre écran en mode speaker en anglais pour pouvoir mieux voir les porte-paroles. Le bouton est situé en haut à la droite de la portion vidéo de l'écran. Reporters with accessibility needs can pin the interpreters or follow along on the YouTube stream. Les journalistes ayant des besoins en matière d'accessibilité peuvent avoir recours aux interprètes ou suivre la diffusion en direct sur YouTube. Today we'll be hearing remarks from Dr. Vera Etches, Chief Medical Officer of Health, Médecin-Chef en Santé Publique, and Dr. Brent Malachny, Associate Medical Officer of Health, Médecin-Chef Adjoint de la Santé Publique. After the remarks from Dr. Etches and Dr. Malachny, we'll then take questions from the media. Please go ahead, Dr. Etches.
So as we start our long weekend, I hope all residents can take some time to enjoy the weather and being outdoors. Please remember to stay 2 meters away from people who do not live in your household. And if you're in public places where that is difficult to maintain that 2-meter distance, please wear a non-medical cloth mask if possible. As some businesses and public spaces reopen, there are increased opportunities for interacting with each other. And so there's a greater chance of the virus spreading. Our message remains the same. The less people you come into contact with, the better to keep COVID-19 pinned down. La réouverture de certains commerces et espaces publics fournira davantage d'occasions pour interagir avec les autres, ce qui risque d'accroître la propagation du virus. Et notre message de mieux donc inchangé, moins les gens entrent en contact les uns avec les autres, mieux nous limitons la propagation de la COVID-19. So we are still in a pandemic situation, and I trust that the people of Ottawa will continue to be vigilant to protect themselves and protect others. Although we are seeing some positive signs, such as the number of cases and deaths decreasing and hospitalization rates stabilizing, the virus has not left our community. So we want to prevent a second wave of the virus because if infections increase rapidly again, our healthcare system could be overwhelmed. More people will die, and businesses will potentially suffer from having to go through a second scaling back of their operations. The daily case numbers continue to show that there is community spread of the virus. So cases that we cannot attribute to direct contact with a confirmed case or travel. For example, we've had 1,753 lab-confirmed cases of COVID-19 in Ottawa to date, with about half, 52%, acquired from institutions. But as for the situation in the community, there were about 20% who had known close contacts that were positive, and approximately 20% were community-acquired cases where the individual could not identify the source of the virus. So contributing to this situation is that people can be asymptomatic and still spread the virus. With a lot of focus on long-term care homes, I believe some people are starting to think that the virus is only circulating in those homes. This is not the case. We're strongly encouraging everyone who has symptoms that could be COVID-19 to self-isolate and then to present for assessment, for evaluation to see if you need to be tested, even if the symptoms are mild, so that we can track down the sources of infection in the community and break those chains of transmission. We do not know how long we will have to live with COVID-19 in the community, so we have to find healthy ways to cope with our new reality. Please stay home if you are ill, continue to wash your hands, and disinfecting shared surfaces and wearing a non-medical mask when physical distancing is not possible. Nous ne savons pas pendant combien de temps nous allons devoir vivre avec cette COVID-19. Alors nous devons trouver des façons saines de nous adapter à cette nouvelle réalité. Veuillez continuer à vous laver les mains, à désinfecter les surfaces communes et à porter un masque non médical quand la distanciation physique n'est pas possible. So my colleague, Dr. Brent Malachny, will share some more about what we are monitoring and about how we will help Ottawa reopen and what the public can do.
Thank you, Dr. Etches. Please go ahead, Dr. Malachny.
Great, thank you, Vera. As more businesses and public spaces reopen in Ottawa, all of us have a role to play. Ottawa Public Health, residents, our partners, and businesses. Some of the key roles for public health are to monitor the number of confirmed cases, identify and follow up with close contacts, identify sources of infection, and control outbreaks in the community. OPH announced on Wednesday that testing is now available to everyone with suspected COVID-19 symptoms. The province also followed with this announcement yesterday for all Ontarians. It is essential for us to identify people with COVID-19 infections and follow up quickly with them to provide information and the importance of self-isolating, and to identify their close contacts so that they can also self-isolate in case they've been infected. This management of cases and their contacts is one of the essential public health measures in place to help keep the virus pinned down as we begin to reopen Ottawa. Again, we encourage anyone with symptoms to go for testing. You can now be assessed for testing at both the assessment center and the care clinics, and they have the capacity for this increased testing. Par conséquent, nous encourageons toutes les personnes qui ont des symptômes à se faire dépister. Vous pouvez maintenant vous présenter dans un centre d'évaluation ou une clinique de soins de la COVID-19 pour subir une évaluation visant à déterminer si vous devez subir un dépistage. Ces endroits ont une capacité accrue de dépistage. People have asked us why they should go for testing, especially if their symptoms are mild and they're managing okay at home. By getting tested, you are helping us find every case so that we can stop the transmission. This information helps us to detect cases more quickly, understand what transmission is occurring in the community, investigate the source, and identify outbreaks earlier. Regarding surveillance testing, healthcare teams in the Champlain Health Region successfully tested residents in all 28 local long-term care homes ahead of the provincial government's May 15th deadline. Over the last 3 weeks, more than 7,000 residents and 8,000 staff have been tested by teams comprised of hospital staff, public health, and paramedics. Meeting this testing mandate reflects a tremendous effort by our regional partners. We would like to take the opportunity to thank the Brewer Assessment Center staff, the Queensway Carleton Hospital, Hôpital Montfort, and the Ottawa Paramedic Service for their commitment to supporting long-term care in the Champlain region. Now, the province has announced the plan to gradually reopen some businesses and public spaces. By slowly reopening, we will be better able to assess and monitor any increases in transmission of the virus within the community, and hopefully reduce the impact of any outbreaks. OPH has links to the province's recommended guidelines for businesses and workplaces on our website to help guide reopening in a way that considers the health and safety of both employees and customers. Tous ces changements augmenteront nos interactions avec les autres et donc le risque d'infection. Nous surveillerons donc les répercussions de la réouverture des commerces et de la levée d'autres restrictions liées à la COVID-19. We will be monitoring the impact of the reopening of businesses and other easing of COVID-19 restrictions. As these changes increase our interactions with others, there is an increased risk of infection rates rising. We have to stay vigilant and continue to practice physical distancing and limiting the total number of people that we come in contact with. These are the effective interventions that allowed us to flatten the curve and kept demands on hospital capacity manageable so far. The recommended physical distancing measures don't change with reopening. Thank you to the people of Ottawa for your hard work and efforts to protect our community. I've already spoken about what to do if you're feeling ill. We also want everyone to continue your efforts to lower the chance that you will spread the virus unknowingly to someone else or that someone will give it to you. When you are outside your home, we recommend that you protect yourself and others by maintaining physical distance of 2 meters or 6 feet as much as possible, limiting close contact to those within your own household as much as possible, washing your hands regularly, and wearing a non-medical, a cloth mask, where physical distancing may not be possible, such as at the grocery store or on public transit. Now, wearing a mask is new for many people, but we've already seen this happening in our community. When more people wear a mask, especially as more businesses and public spaces reopen, wearing masks is one element that allows the city to control the spread of transmission, get control of the disease, and have more freedom. We know that some individuals who are infected with COVID-19 are asymptomatic, and wearing a mask limits their ability to infect others. Quand plus de gens portent un masque, en particulier avec la réouverture de certains commerces et espaces publics, la ville est mieux en mesure de limiter la propagation du virus, de contrôler la maladie et d'avoir une plus grande liberté d'action. Quand vous portez un masque, vous protégez les autres. Comme le président Egli l'a dit hier à l'Assemblée virtuelle, mon masque vous protège et le vôtre me protège. If you are wearing a mask, you're caring for others. As Chair Egli said at yesterday's town hall, my mask protects you and your mask protects me. There's information on our website about where to get a non-medical mask and how to wear and wash a mask. We also launched a mask contest today on the Link Ottawa, Ottawa Public Health's youth-focused Instagram, to encourage youth to embrace proper mask use and come up with fun and quirky names for masks. We also recently connected with residents through an online survey, and the results give us increased confidence that the people of Ottawa are committed to continue to follow public health guidance and protect each other. 94% of respondents said they will continue to practice physical distancing, even as some restrictions are relaxed. And almost 90% of respondents said they would be willing to wear a non-medical mask in public to be allowed to access more services. Lastly, I would like to remind residents that we want to hear your thoughts, perceptions, and understanding of the current restrictions in place related to COVID-19. You can share your feedback through our online platform at engage.ottawa.ca/COVID-19. Thank you again for your community-wide response to this pandemic. Enjoy the long weekend, just 2 meters apart.
Thank you, Doctor. Now for the media questions. In the interest of time, I will quickly read through the list of media who have registered. No need to indicate if you are present. However, if I missed your outlet, please speak up after I am through the list. Pour gagner du temps, je vais lire la liste des médias qui se sont inscrits. Vous n'avez pas besoin d'indiquer si vous êtes présent, sauf si je n'ai pas nommé votre organisation. 1310 News, Canadian Healthcare Technology, CBC, CTV Ottawa, Global News, Le Droit, Ontario Today, Ottawa Citizen, Ottawa Sun, Radio-Canada, Rogers TV, and Your Community Voice. Have I missed an agency? Wonderful. I will now invite each agency in alphabetical order to ask their question. Please remember, you have one question and one follow-up. Nous allons maintenant répondre aux questions des médias en ordre alphabétique. Chacun pourra poser une question et une question de suivi. We'll now start with Chris Curtis with 1310 News.
Hi, yeah, I just want to make sure you guys hear me okay.
We do. Go ahead, Chris.
Excellent. So I just want to make sure for this long weekend, is there any different messaging going out this long weekend than there has been in the past? Is it still stay in your bubble? Has that changed at all?
No, the recommendations to continue practicing physical distancing and to limit your activities to the members of your household as much as possible remain.
Does that apply to Ontarians going to a potential Quebec cottage as well?
My understanding is that in the Outaouais region, the province of Quebec is still asking that people only do essential travel across the border.
Thank you.
All right, now for Norm Tolinsky with Canadian Healthcare Technology.
Thank you. This is my question. How is on the Ottawa Public Health's new COD system an improvement?
We're seeing some positive signs.
Hello, can you hear me?
Hi, Norm. You might have to turn down just the volume on your computer, but yes, we can hear you, so please go ahead.
Turn it down. Okay, just a second.
I heard you asking about our new COD system.
Yes, I'd like to know how it's an improvement over Ontario's troublesome, outdated IFAS system and how it is contributing to your tracking, reporting, and contact tracing responsibilities?
Thank you. I'll start to answer, and Dr. Malachny, if there's anything you want to add, because you're actually using the system, I believe I'm not one of the many that actually interacts with that interface. My understanding is that it's being very well received by our team, that the interface is easy to use, that we are able to grow our case and contact management team with training that is able to be accomplished within a couple of days, given the ease of use of the system. Previously, it was harder to bring people on to train them how to use IFAS. So we have no longer have to use paper to keep track of the details of cases until we can get that information into IFAS through data entry staff. So it's definitely improving the efficiency. The wonderful thing about it is we are able also to make connections between cases more easily by looking at connections between variables. And we are also able to add in new variables to be able to start to track things like ethnicity. So that is my understanding. I think it's probably worth us writing this up a little bit more to share the tool and the usefulness of the tool with others. Anything you'd like to add?
Yeah, no, thanks, Vera. I think that was quite a comprehensive answer. I mean, I think that the staff that have begun using it have really talked about how intuitive it is. I also think that it'll allow us to do more analysis of the data. To be able to look for interactions and common patterns that previously was very difficult to do with paper records. And as I indicated in my opening remarks, this case management piece is going to be very, very important going forward in terms of keeping a lid on or keeping this situation pinned down. And I think this will be a helpful tool for us to be able to do our work easier and better.
Just to follow up, was the system developed in-house or contracted out, and how long did it take to develop?
So I might have to follow up with you offline if you would like a lot more detail on this. We have had a team collaborating to make this system available. It came from Newfoundland, where my understanding is the developers had used this for outbreak management, and they made and now you're getting into an area I really don't know much about. They made the code available for us to adapt it and grow its capabilities for managing COVID-19. And so it did require a bit more development that I believe was done in conjunction with the City of Ottawa IT department and the original developers.
Okay, great. Thank you very much.
Thank you, doctors. Thank you, Norm. All right, up next we have Natalia Goodwin with CBC. Go ahead, Natalia.
Hi there. Dr. Etches, just another follow-up question on businesses opening on Tuesday. We've seen some businesses in the city, such as Costco, do a only mask entry, like you can't get in unless you're wearing a mask. Would you recommend that to some businesses that are opening as a way to prevent the spread?
I think the priority for everybody, whether you're a customer or an employer or an employee in a workplace that's opening, is to protect each other and to decrease the risk of transmission of the virus. And so we know that many measures are being taken to change the way workplaces function in terms of increasing physical distancing, making sure people can wash their hands, and all of these things are important. So the mask is recommended when people cannot keep 2 meters away from others. So if it's that kind of business, that kind of setting, then this is a strong recommendation. There is a lot of guidance for workplaces on our website, occupational health and safety guidance as well from the province. We know that it's not 100% of people can wear a mask, so we want to acknowledge that some people have respiratory disease or different disabilities that make it harder to wear a mask. But we do recommend it strongly that this is something that if we can accomplish it on a large scale across our community, it's going to be very important as we interact more to have these additional protections against the spread of the virus.
Okay, thank you. And just to follow up on that, as we go into this first phase of reopening, what kind of numbers are you going to be looking for in the next couple of weeks that maybe would make you recommend that we claw back? Like what kind of a spike would give your sense to claw back?
What we're looking for is an equilibrium or a nice balance between the level of infection in our community that may go up with more interaction and the hospital capacity and the public health capacity to identify cases, follow up with cases, stop the transmission, and to manage any hospitalizations that result. So we are seeing that the hospitals have good capacity right now, and we are able as a public health system in Ottawa to follow up with all of the cases, over 90% within 24 hours. So these are the kinds of measures we'll continue to watch to see if things are getting out of balance.
Okay, but there's no like specific number, like 300 cases a day or something like that you could point to?
It's hard to give a number because what we're also trying to balance is we know people need to be back at work. We recognize the value of employment and people need income. And so, we need to have some space to allow for that. And we also have seen our healthcare system has had the time now, because everyone did their part with physical distancing, to prepare to be able to ramp up their capacity. So the upper limit of the hospital capacity is more flexible now. People have plans to be able to scale up more beds if they're needed. And so I think that this is going to be a dynamic situation that we follow, that we're in daily contact with our hospital about the situation, and we'll continue to inform the public as well.
Okay, thank you so much.
Thank you, Natalia. CPV News' Josh Pringle.
Thank you and good afternoon. My question is, I guess, for Dr. Etches. We're going into a weekend. Some of the restrictions are starting to be eased. You can now go to a store. People are trying to understand, why can I go to a store, but I can't have people over for a barbecue like one other household? Like, can you explain why we still need to continue to have these physical distancing measures in our home, but I can still go to a store or go places where there's other people?
Yeah, I appreciate that question. What we've heard from the public is that their priorities are to be able to get back out into public spaces like parks, and to be able to have a job again, to be able to access employment and income, as well as have the social connections that are needed also for health. And so we've seen movement on the first, that park spaces can now be used by household members and small groups. The employment is what's behind opening up businesses, right, and getting people back to work. And so each of these lessening of restrictions increases the interactions between people and the risk of infection. And we're going to go slowly so that we can measure that impact of those actions. And so I think that's why it's taken some time to move on the social side in terms of the recommendations for households. The words I've always said are, stay home and interact with your household as much as possible, right? So it's not a rule, it's not a law, it's good advice. And what is as much as possible varies for different people. Some people have to go out to work. Some people have a mental health situation where they need to access other supports to be able to help them. So this is just want people to understand, the less you interact with others, the less likely you are to get the virus. or we are likely to have a rise in infections across the board in our community. And so we know people have done that so far. They've done a great job at physical distancing, and we're asking people to continue to go slowly, to be cautious. We don't want to end up like New York City, and that's a very, very real possibility.
And my follow-up question, we've seen the health unit in Leeds talk about asking people not going to their cottage. Would you recommend that people skip their trip to their cottage this weekend in Ontario and just stay close to home as much as possible this weekend to help limit the spread and reduce your chance of exposure?
My advice continues to be to stay home as much as possible. Yes, it's so difficult. This is a traditional weekend for people to open up cottages. I appreciate that, and I think we're going to have some beautiful weather at some point. And I think if we can enjoy that closer to home, it does decrease the risk of spreading infection across the province.
Thank you. Have a great weekend.
You too.
Thanks, Josh. Up next, we have Craig Lord with Global News. Go ahead, Craig.
Hi, I believe this will be a question for Dr. Etches. We are about 2 months into the lockdown, the pandemic, since you asked people to start staying home. But as you mentioned earlier, we are still seeing incidents of community spread. I'm curious if, from your perspective, if you think there's anything that we as a community, that Ottawa residents could have done better by this point to potentially have eliminated instances of community spread.
I really don't have any complaints about the people of Ottawa. I think the vast majority of people have done their part to stay home, and as much as possible. It's a very ambitious goal to think about eliminating this virus. I think that's not realistic in the short term. I hope we can. I'm not going to. Let's strive for that, but realistically. People need to work. This infection is giving rise to asymptomatic infections that cause spread. It's going to be very challenging to eliminate the virus, and so it's not through any fault of people. I think most people are doing the best they can. It's just what we need now is to continue that effort and to monitor and to go slowly so that we can keep things at a manageable level. It may well be that we continue to make progress with an approach of identifying as many cases as we can and doing that contact tracing. So I guess I would have one ask, a new ask of people in the community. And that is, I think, hopefully was clear in our statements, but I do ask people who have symptoms that could be COVID-19 infection to present for assessment. This is something people maybe didn't realize was possible before, because the message has been out there that the tests are limited, only healthcare workers, essential workers. That's changed. And so that is my new ask as we enter into this phase of reopening, to do your part by helping us identify each of those cases. And this is the way we'll work towards that really ambitious goal of elimination. And the travel is also important. So as we go forward, one of the continuing challenges to elimination will be people traveling to areas that are more affected and bringing back the virus. So again, that staying as close to home as possible will help.
Great. And just a quick follow-up actually on the travel question. I'm not sure if this is an OPH actual decision to make, but when someone travels, say, out of the province or out of the country and then comes back and they're asked to self-isolate for those 14 days, if they get a test done, and it comes back negative, do they still have to do that self-isolation, or what is the kind of gray area there?
Yes, there's a lot of talk about testing and how it can help or not help. So unfortunately, a test at one point in time does not rule out that somebody is infected. and just in the early stages of infection or incubating the virus. And so when someone returns from a country more affected, the quarantine does stay in place for 14 days, even if they've been tested and it's come back negative. We want to wait that full incubation period. We're also seeing some employers now. You can imagine, I totally get it. They want to have their employees tested before their employees come back to work. It seems like an extra layer of security that their employees aren't going to be infected or pass the infection on. Same challenge there. There is no guarantee that test on Saturday means that they're okay on Tuesday. And so we don't want employers to be trying to get their asymptomatic well employees tested before they go back to work. We need to reserve our testing capacity for those who have symptoms and for handling outbreaks.
Great, thanks so much.
Thank you. Maintenant, nous irons à le droit Julien Paquette. À vous.
Merci. Oui, je constate que vous insistez beaucoup sur les nouveaux paramètres au niveau pour accueillir les gens qui vont pouvoir être testés. Est-ce que vous avez l'impression que ce message-là, que tous les résidents d'Ottawa qui sont maintenant qui ont des symptômes peuvent être testés, avez-vous l'impression que ce message-là n'a pas encore été entendu?
Oui, je pense que c'est important de répéter le message que le dépistage pour COVID-19 est disponible pour tout le monde qui a un symptôme qui est peut-être infection avec COVID-19 parce que le message auparavant était qu'il n'y a pas beaucoup de dépistage et c'est pour les travailleurs en santé. Et ça prend le temps de changer les idées dans la population, répétition. J'apprécie votre part pour concentrer sur ce message. C'est aussi un défi parce que pour la majorité des gens, heureusement, la maladie n'est pas trop sévère. Et avec un symptôme qui est peut-être juste un mal à la tête ou peut-être fatigue, c'est pas commun pour les gens d'aller faire une évaluation. Alors ça, c'est différent aussi. Et maintenant, c'est une priorité d'identifier les cas. Et alors, je voudrais voir que tout le monde qui a des symptômes vient aller faire une évaluation.
Parfait, merci. Et puis, l'autre question que je voulais vous poser, c'est, je ne sais pas si ça fait partie des choses que vous entendez quand vous consultez la population, mais est-ce que vous craignez qu'avec les mesures restrictives qui sont assouplies et le fait que ça fait à peu près 2 mois que tout le monde est confiné, que les gens commencent à se laisser aller un peu, à prendre les mesures un petit peu moins au sérieux et tourner des coins ronds. Hein.
OK, je comprends que la question, c'est concernant les mesures et leur efficacité pendant ces 2 mois. Et si on peut tourner...
En fait, est-ce que vous craignez que les gens commencent à en avoir assez d'être seuls à la maison et commencent à tourner un peu les coins ronds, à dire, bon, ben si j'invite un ami chez moi, c'est pas plus grave que ça, c'est juste on est juste 2 ou 3, même si c'est pas des gens qui habitent dans la même résidence au départ.
OK, je m'excuse, mon français, c'est pas parfait. Je comprends que vous voulez savoir si c'est possible de tourner au...
I'll ask it in English
okay.
if it's easier.
Okay.
My question is, do you worry that people start to ease off on some of the restrictions? Maybe start to say, well, I'll invite one friend over, and even if it's not a member of my household, it's just one person. We're not a group of 2025 is just, so do you worry that people get sick of being home alone and start to ease off on the restrictions?
Pour moi, je comprends que c'est difficile cet avis de garder les relations avec juste les gens qui habitent avec vous. Et oui, je comprends, ça devient plus difficile avec la quantité de temps qui est passé. C'est important maintenant, pendant cette période, de commencer avec la relaxation des restrictions pour les travailleurs, de prendre le temps de déterminer quels sont les impacts sur le niveau d'infection dans notre communauté. Alors, on va un plan d'aller lentement pour évaluer l'impact. Et je comprends aussi la population veut avoir plus de liberté concernant les visiteurs. Si c'est une question de santé mentale, quelqu'un a besoin de soutien, absolument, c'est important de faire les liens avec les autres. Mais si c'est une question de relations sociales, j'encourage les gens de faire une visite avec la distanciation physique. C'est le cas que maintenant, le virus est encore dans notre communauté et chaque interaction peut augmenter le risque pour les visiteurs et pour la maison, les personnes dans la maison.
Parfait, merci Julien. May we have Amanda Pfeffer with Ontario Today?
Hi, can you hear me?
Yes, we can.
Oh, good. Okay, fantastic. So I'm thinking about the people who, as we open up the province, the people who have to wait a little bit longer, people with underlying conditions, and I think it's seniors over 70, if I have that right. So what is your advice then to seniors and people with underlying conditions in terms of, as the province opens, what is your advisement? Are they stuck inside until in a kind of self-isolation until there's a vaccine or a cure? What is your advisement to them?
My advice is that we want to make sure that they're protected from virus that's still circulating in our community. And so to continue to look for ways to have supports delivered to the home, to continue to look for virtual methods for connecting with family and friends, and to stay on top of the emerging information that we will be continuing to share information about the level of infection in our community. We're hoping that will continue to trend down and that we'll reach a level that makes it safer for everyone, especially people over 70. Unfortunately, that is the age group where we see higher rates of mortality.
And so is that advisement then look like it could be many, many months longer? Is the true, are they really released from this kind of self-isolation only when that certainty comes with, a vaccine? And I'm just wondering also the public health challenge there. The public health challenge you're thinking about for these people with underlying conditions. How are you going to monitor this group?
So a couple of things. One is that the modeling that we follow that gives us an idea of the path into the future shows that if we continue this level of physical distancing that we're doing now, the level of infection in our community will keep dropping. In fact, by the end of May, if we continue this level of physical distancing, we'll be very encouraged by very much lower levels of infection in our community. So this is good news. It doesn't mean months and months and months with a higher level of infection. However, we're just trying to calibrate, where we're trying to balance against the increased risk of growing levels of infection as we interact with people more. It's why we all need to do our part so that people who are more at risk of a negative outcome, will have the opportunity to get out and about again sooner rather than later. The other piece is of how we're checking in on people who are over 70, who are more socially isolated, is through the Human Needs Task Force. So again, Volunteer Ottawa has been helping, the United Way, the Ottawa Community Foundation. All of these groups have been finding ways to reach those who have less advantage or more challenge in our community. And that includes wellness visits by the Red Cross. People are going to homes and checking on people, and this will continue.
Great, thank you, Amanda. On to Joanne Loshes with the Ottawa Citizen. Go ahead, Joanne.
Hi, this is Aidan Helmer with the Ottawa Citizen. I'm going to ask that question on behalf of Joanne, if that's okay.
Yeah, absolutely. I see her microphone's not working, so please go ahead.
Okay. So we're just asking with many of a lot of the playing fields and parks being opened to people on a gradual basis. There's going to be a lot of temptation, I think, for a lot of people to sort of gather, perhaps in groups, perhaps larger than 5 people. I'm just wondering how the city is going to be policing that, level that bylaw might be involved, and whether there's going to be a zero tolerance like there was back in the early days when people were being ticketed for remaining in parks for too long. Just wondering how that's going to be policed.
Thank you. Getting into territory here that is really more of the City of Ottawa territory, but we work together. And I can tell you that the City of Ottawa's focus is to use the park ambassadors, the new role that's been created, to help people understand what the current environment is. So yes, people can use the green space. They can now go onto the ball fields. They can go onto the soccer fields with members of their household or in groups of 5 or less. And there's to be no organized sports activities, things like that. So the park ambassador's role is to educate and to help people understand, and to share the rationale. I think which I can emphasize from a public health point of view is that we're not through this pandemic. We have things that are going to increase the risk of transmission, and we need to keep doing our part to counteract that by staying 2 meters away from others who aren't in our household.
Thank you.
And Aidan, you were actually next on the list. Do you have a question?
We're just going to combine those two. We'll just combine the Citizen and Sun together today, I believe.
Perfect. Do you have a follow-up?
Have a great long weekend.
Thank you. So up next, we have maintenant nous irons Dominique Desgrais avec Radio-Canada. Dominique, à vous.
Oui, bonjour. Ma première question, ce serait en 2 volets, si possible. D'abord, peut-être me répéter en français ce qui a été fait pour tester dans les maisons de soins de longue durée. Donc, vous avez réussi à atteindre vos objectifs de dépister tout le monde, d'un côté, mais aussi en suivi à ça, quand est-ce qu'on va savoir combien de ces 7000, je pense, résidents-là ont la maladie ou pas? Est-ce que c'est déjà comptabilisé dans les bulletins quotidiens ou est-ce que ça va suivre dans les prochains jours?
Je m'excuse, juste un moment. J'ai cherché pour les numéros pour votre première question et je pense que je manque le deuxième. Premièrement, je peux juste répondre absolument. Avec nos partenaires, nous avons accompli l'exercice de surveillance dans le foyer de soins de longue durée. Pas aujourd'hui, avant aujourd'hui. Le nombre de résidents qui a eu un dépistage, c'était 7000. Et pour les employés, c'était 8000. C'est plus que les deux, mais c'est les numéros. Et c'était avec les hôpitaux, les paramedics et Santé publique Ottawa et avec le soutien de le foyer de soins de longue durée.
Et le deuxième volet de cette question-là, c'est de savoir, on a fait passer les tests à ces 7000 résidents-là, à ces 8000 employés-là? Quand est-ce qu'on va savoir dans ce bassin-là qui est positif, combien de personnes sont positives ou négatives à la COVID-19?
OK, bon, je n'ai pas tous les résultats maintenant. On a besoin de continuer avec les études des résultats et pour la plupart, nous avons trouvé dans les maisons où il y a déjà une grande éclosion avec un grand nombre de cas, nous avons trouvé d'autres cas. Mais pour la majorité des maisons où la situation est stable, il n'y a pas une éclosion, nous n'avons pas trouvé des cas. Ça, c'est les grandes vues, mais j'imagine, Dr. Milochney, tu n'as pas aussi des détails à ce moment. On va continuer d'évaluer les résultats pendant la fin de semaine.
D'accord. Et peut-être mon follow-up, c'est sur les masques, en fait. Et au Québec, la santé publique, sa position, c'est de recommander fortement le port du masque en public, surtout quand la distanciation n'est pas possible. Vous avez dit que vous recommandez fortement aussi les masques. Aujourd'hui, au Québec, il y a beaucoup de questions de le rendre peut-être obligatoire dans les transports en commun, dans les grandes villes. Vous, pour ce qui est d'Ottawa, est-ce que c'est quelque chose que vous observez aussi ou quelque chose qui serait nécessaire, c'est-à-dire d'obliger le masque dans des espaces plus petits, des espaces publics plus petits comme le transport en commun?
Oui, la recommandation forte pour l'utilisation des masques est parce que ça peut donner protection aux autres quand c'est impossible de garder une distance de 2 mètres entre eux. Et c'est vraiment difficile, bien sûr, sur les autobus ou un train. Alors, c'est une conversation avec beaucoup de différentes villes pour examiner la question d'une recommandation que c'est obligatoire sur le transport en commun. Vous pouvez imaginer, il y a certaines dimension importante. Si quelque chose est obligatoire, c'est important que les passagers aient accès au masque. C'est aussi important que la population comprenne comment on utilise un masque dans une méthode sécuritaire. Alors, je voudrais recommander notre site web santépubliqueottawa.ca/coronavirus parce qu'il y a information là concernant des sources des masques, comment on peut faire un masque, comment on peut laver et réussir un masque. Alors, j'imagine la conversation va continuer concernant la recommandation pour le transport en commun. Maintenant, c'est mon avis que c'est une bonne idée.
Merci.
Parfait, merci Dominique. Up next, we have Patrick Aguccioni with Your Community Voice. Go ahead, Patrick.
Dr. Etches, the province was reluctant to let any one district or region sort of open up before others. Going the other way, if there was, say, a spike in Ottawa, would that be your decision to sort of slam the door again, or would the province have to step in? And just wondering how that would work.
Don't like the sound of that door slamming.
Well, I mean, sort of put the same restrictions back in place, like close the parks and
the first thing to do, which we're doing, is to monitor the situation closely so that we would detect any rise in the level of infection in our community very rapidly. The second thing is to make sure we have all the tools in place and that we're using them to stop the transmission when we identify cases and keep the level of infection under control. Any decision, if it looks like we're not able to keep infection levels to a manageable level, it'll be a conversation with the province. They'll be noticing that. We'll be telling them. We'll be talking together. We'll be working with our healthcare partners. We'll be talking to the community because everything that's making a difference right now is community action, and we want the population to continue to be informed and understand what their contribution is. It's really each of our responsibility to keep the level manageable through keeping 2 meters away from others as much as possible, or using a mask if we can't. So I don't think there'll be a sudden, action that I'll have to take. I think this will be informed conversation, multiple people, including the public, and it could be, I think, to get at the core of your question, perhaps, it could be that Ottawa is different from the surrounding area. We've already seen that. Some places that are more rural have fewer cases. There's just more risk when you live in an urban center. And so it could be that we have to take a different action in Ottawa compared to somewhere else. But again, that would be something that, I think we'll have some time for dialogue.
Thank you. And I was wondering if you could clarify something from the virtual town hall. I think you were saying that, there's a lot of attention about the infection rate and people over 70 or seniors, but we shouldn't assume that young people aren't getting it. Maybe we're not just seeing the symptoms. I know you put those numbers out every day, but I wonder if you could clarify that for me, that we shouldn't assume because we don't see a lot of young children showing symptoms that it's not there.
That is correct. I would be very surprised if children are somehow not infected. The evidence is pointing to the contrary. When you look at studies that have been done of populations in other parts of the world, children are infected. They're infected at probably the same rate as their parents, right? The middle-aged population. However, they don't seem to get the severe illness. And so in our community, we are testing people who are, under age 15. They're coming forward for testing, but the hospitalizations have been very, very limited, and the severity of the illness, and even the proportion coming forward, it's lowest for that age group under 15. And so we don't see it, we're not detecting it, but it's probably there. And that's something, that we're keeping in mind when we think about the way forward, right? Whether schools or daycares or camps are going to be open. We won't assume that the infection spares children. We'll assume that we need to take all the precautions of screening for illness, making sure we're checking if people have symptoms, and making sure we're practicing physical distancing in new ways, reducing sizes of groups if we're going to have children get together.
Thank you very much.
Great, thank you. That is all the time we have. C'est tout le temps dont nous disposons aujourd'hui. Thank you very much for joining us. Have a great long weekend. Merci à nous rejoindre. Au revoir.
Merci.